So, hi, this is Eric Rabel. I'm a managing editor for DocWire News, and we are speaking today for a couple of minutes with the mayor of Robbinsville, New Jersey, David Freed. Thank you for taking a couple of minutes today, Mr. Mayor, to speak with us. We are going to be focusing on sort of the small government, local steps that are being taken and actions that are being implemented regarding the COVID-19 pandemic. I guess my first question is, what are some of the steps that you have taken in your community to assist maybe the local healthcare providers or the community at large in testing and dealing with this whole thing? And I guess I can just let you, explain.
Sure. We were fortunate. When we saw this, sort of breaking loose in China, I had a little bit of a feeling that this might turn into a bigger issue than perhaps we had thought about. So I actually called our team together, and we began purchasing supplies, ordering supplies, cleaning supplies, PPE equipment, and started really preparing for what may be coming. So back in early January, we were well ahead of the curve. We had quite a bit of equipment available. We had quite a bit of product available, cleaning supplies available. So we were very fortunate there, and we started immediately providing it to quite a number of the local authorities. Mm-hmm. We started providing it and sharing it with other towns. We started providing and sharing it with the county. We were also very lucky in that we had a very large BAPS temple in our town. Mm-hmm. And they've been great community partners with us. And they were also being able to give us a tremendous amount of donations of masks, gloves, cleaning equipment. Mm-hmm. So we've been able to really stay in front of, a lot of what was happening, and also be, a resource for the rest of the county in terms of having these supplies and having them be available to our residents. So once we got all of our sort of frontline workers equipped with PPE, we then started to hand it out to our seniors. We also started trying to provide cleaning supplies to those who were infected. And then just this week, we started handing out masks to the general population of our residents. So we're out between 9:30 and noon every day, giving out masks to the residents so that everyone can be protected.
Okay, great. So I'm actually going to kind of skip the next question, do these a little out of order. What are some of the challenges that you face? I know you said you guys got out ahead of the curve a little early, but I mean, have there been roadblocks, or has there been anything that's been, annoying in the process? What have you?
Oh, lots of annoying things. So the biggest challenges, that we had, one of the things that we got early was we had a large supply of the malaria medicine brought mm-hmm. into the region. But the governor decided to change the rules on that malaria medicine. While it doesn't work for everyone, it does work for some people. At least that's been the reports that we've gotten. And they changed the rules that you could not receive the malaria medicine unless you had tested positive. Mm-hmm. The challenge that we had, at least locally, was it was very, very difficult to get tested. So we had the medicine. We knew that it worked at least for some portion of the population. But we couldn't get that population tested, therefore we couldn't get the medicine to the right people. That was very, very frustrating. So then we set up a local testing site in town. So Robbinsville is actually the only town in Mercer County right now that has its own local testing in it. The county is testing for the county, but there are 2 sites in Mercer County right now, and we're actually one of them.
Okay. Sure. So on the flip side of that, what do you think has worked, if anything, exceptionally well, or maybe better than you had anticipated?
The volunteerism and the donations have been incredible. I've been trying to communicate with our community via Facebook, which has turned into a real good vehicle for me, not only to let people know what's happening, but also to be able to ask for help. We've been asking for cleaning supplies. We've been asking for volunteers. Once you have an entire family with the virus, it gets difficult for them to go out. So we've now got volunteers willing to shop for families, and even little things that you might take for granted, walking your dog and doing some other things. When the entire family is infected, these little things become more and more difficult. So the The volunteerism in our community has been incredible. Every time I put out a post and ask for things, I immediately get responses. The donations have been incredible. We're seeing, the need for food increase dramatically. In fact, our Meals on Wheels has now quadrupled. Our food pantry is being used more often than we've ever seen before. So we're starting to see the needs of those who have been out of work for a long period of time, start to mount up. I was not a fan of the closure of the parks. I think people need to go out and exercise. We kept our local parks open. I was a little disappointed to see the state and the county parks closed.
Hmm.
My biggest concerns right now are, the food supply, making sure that continues, and that, we can continue to get the supplies that we need. And also, people being able to have the resources to be able to just provide themselves the normal necessities, food, etc.
Sure. Do you have any advice that you could share with from the experience here with other, mayors of maybe a town similar size? Are there best practices that you've been following, or is there anything that you've kind of dealt with in the moment and said, this looks like it's a good way to go?
Well, listen, if you can, find a way to communicate effectively with the community, that is number one. I mean, I've been lucky, most of the town follows my Facebook posts, and I've been communicating very well. The more you communicate with people, I think the better off you're going to be.
Mm-hmm.
Bad news doesn't get any better. Better to get it out in front of it, let people know what's happening. And then, being willing to ask for help. I mean, none of us are infallible. And I find every time I need help, I put it out there, and my residents help me figure it out. We've got a lot of very, very smart people in our community, so you don't have to do it all yourself. Ask for help, ask for volunteers, and you'd be surprised how quickly you can be able to respond to things.
Mm-hmm.
I think we're probably one of the only towns in the region that are literally handing out masks to every resident. And we were able to do so because we literally got in front of as much as we possibly could, and we asked for help. And this one knew that one, and we were able to be able to purchase, get donations, and be able to provide things for our residents.
Great. Just a couple more here. So, is there any on kind of the provider, the care provider side of that? What do you have any advice for any medical personnel or hospitals or care facilities that would be partnering with local governments? Is there anything that they can do to enhance the two-way camaraderie and make sure that everything works as well as it can?
We've been blessed. I mean, we had a local connection with one of our pharmacies who had a connection to bring in the malaria medicine to help treat our residents. We've had a number of doctors sharing with us what seems to be working with their patients. We've had a urgent care center partner with the township, and they were actually willing to put a testing facility on site right at the municipal building, where they actually did the testing, and we provided the logistics as well as sort of the traffic control and everything else. So we've done a number of public private partnerships, working with our churches. Our pastors in this community are more like generals and sort of organizing donations, and also making sure that those who have the virus are taken care of. And then lastly, making sure that those who have the virus don't feel like they're being a bother, don't feel like they're somehow, being excluded from your community.
Mm-hmm.
We had a lot of people who, wanted to know, who it was, where it was. And, we had a lot of residents who had the virus who were feeling, like almost like they were wearing the scarlet letter.
Mm-hmm.
And, we immediately tried to change the tone of that, because those who are coming out of recovery, and we've literally got as many people right now coming out of recovery as we have going in,
Mm-hmm.
which is a tremendous statistic. These are our new superheroes. These are the folks that I can send on the front lines. These are the folks who are now donating their antibodies, from their blood. These are the folks that I can send to those who have viruses, currently going on, and can go shopping. So,
Right.
I really think that the more we, communicate with those who have the virus and show them that we're here from them, is going to encourage them to, to pay it forward and be there for the next person. I know that our residents who are speaking to people who have gone through the virus, who have just recently tested positive, have found that to be a really, really meaningful thing, to be able to talk to someone who's gone through it, can sort of share with them some of what's going to happen. That has been something that, those who are going through the virus right now have been very grateful for.
Okay, great. And so I guess my last question would just be, was there anything we were kind of chatting about here that I didn't hit or that you didn't hit kind of in your responses that you wanted to just make clear, or any special messaging out there that you had in mind?
I think, the biggest thing right now is for people to remember that this will be over, that we'll rebuild our lives, that we'll get our jobs back, that we're going to recover, and, to continue to just treat one another as well as you possibly can. I think a lot of people have been inside for too long. People are starting to get frustrated. So just, to remember to be patient, count to 5 before you talk, especially online, and, use kind words. I know it sounds silly, but,
Yeah.
as people have been inside, they're, the frustration is building, and, we just need to take a breath, take a step back, and remember that, we're all in this together. And, hopefully we'll look back on this and learn a lot of lessons, but we will look back on this and, things will improve.